We're good. I don't.
All right. Well, welcome all of you who are popping into the webinar. Welcome. And we'll get started in about 1 minute, giving everybody time to come from the waiting room into the webinar. And other folks who are popping on right at the 1 o'clock hour, we want to give people just a minute or so. So while you are doing that, if you want to just pop in the chat, who you are, where you're from, say hello. We would greatly appreciate it just to see where everybody's from. And we'll get started in about 1 minute. So welcome. Let us know who you are. Welcome, Veronica. San Francisco Bay Area. Patrick, glad you're here. New York. On Track, New York in Kingston. Supportive education. Awesome. Thank you guys. Keep it coming. Coming in so fast, can't keep up with it. Colleen from New Jersey, Philadelphia. Very good. Cameron, California. Very good. Tennessee, Kimberly, Pennsylvania in the house. Awesome. West Virginia, Seattle, California. Very good. Oh, there's Jamie from the Center of Psych Rehab in Boston. Hey, Jamie. Boston. Got Boston representing today. California, Minnesota, North Carolina. Well, I'm in South Carolina, remotely working for Boston University. So I am on the real close to North Carolina. About 40 minutes I can be in North Carolina. So welcome, North Carolinian. Chapel Hill. Very good. Washington Spirit Center. Very good. Love it. University of Washington. Love it. Well, you guys keep it coming. As you're popping in, let us know who you are. Say hi to each other. I'm glad everybody's doing that. It's always a great indicator we're going to have a great hour together. So stay tuned. We're going to have a very informative session today in our webinar and give you guys a lot of opportunity to ask questions and give insight because this is Ask Me Anything. So, oh, we got somebody from Raleigh. Awesome. North Carolina's representing today in California, Boston. We're doing good. Well, let's go ahead and get started. It's about 3 minutes after 1, and we want to make sure that we give our guest speaker enough time to give her expert uh, information and about our topic today, and give you enough time to get your questions out there and get them answered. So let's get started. Well, good afternoon, everybody, and welcome to Ask Me Anything About Employment with our expert, Dr. Shannon Blajeski. I've been practicing that name, and she told me she would correct me if I don't do well. But my name is Lisa Kristanak, and I'll be your moderator today. And we have Amanda Lowe, who's on the backdrop here as our tech support. Today's event is funded by NIDLR, which is the National Institute on Disability, Independent Living, and Rehabilitation Research. This webinar is not a presentation, but rather it's an interactive question and answer period. So for the next hour, Dr. Shannon will respond to any questions and that's related to our topic today. And our topic today is the importance of engaged career development with young adults in early psychosis programs. So for today, I'm going to introduce Shannon and give her time to expound on this topic. Then we will take questions. Please put your questions in the chat throughout the whole presentation, or even now if something comes to mind. So it is my pleasure to introduce Dr. Shannon Blajeski, a leading mental health intervention researcher whose work focuses on creating better career and income pathways for young adults experiencing early psychosis. Her goal is to disrupt the cycle of long-term poverty and disability benefit dependence that too often accompanies these experiences. Dr. Blajeski brings a rich background to her research, combining extensive clinical social work experience in behavioral health with scholarly expertise in social welfare. She also brings a decade of implementing the Assertive Community Treatment Act model, a foundation that continues to shape her approach. Currently, Shannon serves as the assistant professor in the School of Social Work at Portland State University and is a valued collaborator with the Boston University Center for Psychiatric Rehabilitation. She's also actively partnering with Michigan Navigate and the Oregon EASA Center for Excellence on key research initiatives. We're excited to hear from Shannon today and look forward to all of your questions. So audience, please feel free to start putting your questions into the chat throughout the presentation. And Shannon, we're excited to have you here with us today. And now I'll hand it over to you.
All right. Thank you, Lisa, for the long introduction. I really appreciate, I can say less now, so I really appreciate whenever I can say less. Hi, everybody. I'm going to switch this to slideshow mode so it's a little clearer looking. And then let's see, making sure that everybody can see the slideshow. Okay, so now it should look larger for you all. Does that look okay?
Looks good.
Okay, great. So hi, everybody. Good morning-ish West Coast people and good afternoon people on the East Coast and in between. My name is Dr. Shannon Blajeski, and I'm an assistant professor at the School of Social Work at Portland State University. As evidenced by where I work, I am a social worker by training. I spent a long period of time in clinical mental health settings from a range of low resources like homelessness services and mental health to implementing the assertive community treatment model with my colleagues over at the now UW Spirit Center here who are on the call on the webinar. So that is what really led me to this work. And I really appreciate Lisa's overview of the just kind of thinking about that poverty prevention is really at the heart of the work that I do. When I look back at all of the direct practice settings I worked in community mental health and then working with ACT teams, the one kind of common thread, there were really two kind of common threads throughout that whole period of things. And by common thread, I mean things that people who were diagnosed with, say, schizophrenia or early psychosis talked about that they wanted, that they weren't getting. And it was working and social support. And so those two areas are sort of not something that the field of psychiatry really focuses on, but it is something that the field of social work is very sort of rooted in. And so I kind of combine these two areas in my work. And that's just a little bit of a background on me and something to prep you with as we move forward. So let's go ahead and get started. So the topic today is the importance of engaged career development with young adults in early psychosis programs. And I'm going to sort of unpack a little bit about the background and why this is important. Then I'll be talking a little bit about some of my current work and some studies that we have going. And then I'll just end talking about, what can we do now if we can't, pilot a new program in our early psychosis program? What are some things that we could think about on our teams now? So I am going to go ahead and get started. So I want to start by defining this acronym that is called NEAT. NEAT stands for Not in Education, Employment, or Training. It is a term that actually came out of the UK to describe, youth who basically don't enter the labor market. They're not getting jobs. They're not going to school. They're just sort of like languishing. And there are researchers in, I believe in Toronto, who had been doing some early work looking at NEAT rates on early psychosis programs. And so I kind of got inspired when I learned about them, because when I did my dissertation work, I found that there was this sort of divide where it seemed like young people who had career goals, maybe they dropped out of college, went into an early psychosis program, were able to kind of recover a little bit, get back to college, finish, go into the workforce, despite symptoms. And then there were a subset of young adults, though, who sort of never could quite get on track. They couldn't quite figure out what their track was. And it sort of told me that there was something going on where the early psychosis programs aren't necessarily equipped well to help everybody who comes through the program. And so when we look at the this Rosenheck study from 2017, they looked at the RAISE data and they found that about 40% of young adults actually are remaining not in employment, education, or training when they complete programs. Some of you are thinking, well, some people's illnesses can be so bad that like they really aren't able to recover. And that is true. There are always going to be some individuals who are really just kind of struggling the whole program to figure things out for themselves. But there is another subset who sort of like kind of get labeled like not ready or over here, and they aren't necessarily going forward. So that's why we're talking about NEAT as an acronym to describe that subset of people. The other reason why we care about NEAT in early psychosis is because those young adults who are not engaged in employment, education, or training are at a higher risk of poor life outcomes, such as long-term unemployment and long-term poverty. I believe that you've all heard the statistic that, $100,000 in the year 2020 is now equivalent to $120,000. So as like the dollar gets weaker and we're all paying more for less, people who are on this very fixed disability income are in even worse positions than they were 10 years ago. It used to be that one person's Social Security disability check could kind of cover like a low-income apartment, and I'm not even sure that's the case, especially in some of our higher cost areas. So this is a really important thing to really be thinking about. How do we restore access to earning potential for especially young adults? This is also important because income is a social determinant of health. So, we know that, sorry, the chat's jumping up and going in front of my thing here. Hold on one second. I just need to reshare my screen. Oh, I see what happened. It went out. Hold on one second. Technical difficulties. Can you all still see the slideshow? Oh, you can. Okay, this is good. Lisa, does it still look the same as it did before on your end?
Yes.
Okay, great. I'll keep going. So income is a social determinant of health. And what that means is that it is helpful in making our overall wellness better. So if we think about times when we've struggled with money, what happens? You get stressed. The stress can kind of cause a drop in serotonin sometimes. I know it does for me. And, I feel like there's like an additional barrier that I'm dealing with. So anything that I'm dealing with in my life gets worse when I have a lack of access to income. And so, that's obviously a very significant thing for our individuals who are struggling with chronic mental health issues. So now it's not letting me do this. There we go. Okay. Okay, so another thing I wanted to mention is this long-term study from the OPUS program in Copenhagen and in Denmark. So this is a program that's been running for a very, very long time. And so they have a lot of long-term data on their early psychosis models. And this article was really fascinating because if they looked at all these kind of life areas as well as like kind of traditional symptoms and hospitalization rates, and they found that this is showing on the right-hand side here, this chart that 5 years after the program, working or studying goes up over time. So maybe it's kind of some are working, some aren't right when they graduate, but if they track people in years 2, 3, 4, 5, they see that, there's kind of, if not like staying the same, at least an increase for individuals. I also think it's interesting that if you compare that against alcohol and substance use disorders, you sort of see it going down. And this is really what we see in the research, which is that if for people who struggle with using substances, when we replace sort of negative behaviors or negative situations with positive ones like working, that people tend to like naturally just reduce their use. So this is sort of interesting in terms of just a plug for why it's important, in case we don't feel that it is important still, that it is very important for us to focus on employment and education. Here's the rest of their data. So on the right-hand side, there's the same working and studying and substance use disorder. On the left side, you see that actually psychiatric bed stays and admissions, those are hospitalizations, and then somatic, which would be like mood situations or suicidal ideation, that those kind of go up and down still. So over the same 5-year period after completing an OPUS program, individuals might still kind of struggle with their mental health up and down, as we would expect, but like their life stuff is actually kind of improving over time. And so I think that says a lot for how we shouldn't be like discharging people and just thinking about their symptoms anymore. We should be having them graduate into feeling like they can be working on their life goals in the context of these other things. My dog is now fully snoring under my chair. So if you hear anything that sounds like snoring, that's the dog. Okay. So we were interested in learning more about NEAT in the US. So we did a scoping review. This is going to be an article coming out soon, hopefully. We wanted to see, have there been studies on early psychosis programs where they looked at people who kind of had this NEAT status in the beginning, and they looked at them at the end and kind of looked at what led to them getting back to work or school, or being what we consider a disability, not doing work or school. And we found really interesting things. So this is actually, international, not just US. So we found that low educational attainment at baseline, so usually that's less than a high school diploma, that was a significant predictor of having NEAT status at the end. So really not getting back to a work or school track or getting on one during the program. Racial ethnic minority status, that was sort of not across the board, because we found that it was more significant for populations who experience long-term societal marginalization by the majority population. So we actually saw that like new refugee status often had like higher employment rates for young people when they entered psychosis programs than like populations who've maybe been suffering discrimination, structural stuff in their home countries as a result of being the minority population. So like BIPOC individuals in the US, for example, had a lower, was like a predictor of not being in employment and education at the end. Social economic and structural disadvantages, so having welfare benefits or being homeless at the beginning of the program usually meant that they struggled throughout the program to really get on these career tracks. And then substance use during the program. And as you all know, that's a very difficult thing when you're trying to get everything else set up for the person, and then they're using substances continually. That just becomes a barrier. So these are just some of like we call them predictors that we know about for what keeps people in NEAT status. So this is typically what happens on programs. So, those of you who are here who are vocational specialists or employment specialists, you're working maybe on track with IPSY or with the C model. So I'm going to be using the C acronym going forward. That's something that Navigate uses. So those of you using the Navigate model, it's supported employment and education, or C. So typically what happens with young adults who have NEAT status is they might meet with you in the first 3 months that they're enrolled. And you might say, oh, are there something that you're interested in working on with employment or school, or do you have any ideas or goals? And they kind of say, no, not currently, or no, thank you, politely declining to engage. And what usually happens in that case, and this is what we heard from C staff, and I'll talk about that in a second, is that, kind of no further assessment might happen because they're sort of deemed not ready. We also heard the term not motivated from C staff that we talked to. And what happens then is that the young adult just delays. They delay working on it. They delay coming up with goals. They don't know where to start. And then by the time they end this program, they're just not working on education or employment. And that's our 40% that we're seeing. So what we heard is that, because some of these models are offshoots of the original IPS model for adults, we start with the goal. And so if young adults don't have a goal, they're sort of like, well, we don't have that much time. We have to meet fidelity. We're going to work really hard with the people who have goals so that we can show that we're helping people get jobs and get back to school. And we understand that, from thinking about improving models perspective, but that's sort of, I think, the mess that happens on programs. So just really quickly, before we move to thinking about what we can do and why career development matters, I just want to tell you about a brief study that we have been working on. So we started a participatory advisory group with lived experience, young adults, some early psychosis, a trainer, and a C expert trainer, 2 C specialists, and we all met every other month for a year to talk about this problem. What could we do to like solve this problem? And so we ended up interviewing and recruiting young adults who had NEET status and who had experienced multiple barriers. You can see the list here for their barriers to getting into a work and school track during their early psychosis programs. I think almost all of them were graduated or about to graduate. And then we also wanted to hear from C staff. So we had focus groups with 7 C staff. I believe we did 3 focus groups, and then we did a follow-up focus group at the end. And I'm just going to share with you a few of the things that we learned. So young adults, when we talked to them about what the barriers were for them in their programs, they said, well, in the beginning, I was just surviving. This word surviving came up several times, meaning that like I was disorganized. I couldn't think about goals. I was in this just very, suffering place where I needed time to get on my feet. But they also said I didn't have confidence. They said if somebody had asked me what my job or school goal was, I would have not known what to say because at that moment I was just surviving. It didn't mean I didn't want to work on work or school goals, but I didn't know what to say and I didn't know how to even start with that process. And then when they were a little further along, they said, well, in my program, maybe they only worked on jobs and I just didn't know what I wanted to do. And I wanted to know what it was like to go to college. I wanted to know what it was like to write an essay for admissions essay, for example. I wanted someone to help me explore my interests, like kind of like a basic high school career counselor level kind of stuff. And as we know, that sort of was considered pre-vocational work and taken out of the original IPS model. So there's a reason why we don't have a lot of specific like curriculum around that in the C model, for example. And so they wanted to start small. They wanted to explore their career interests. And then they wanted to learn about things like, how do I adapt in a job or how do I get accommodations? They don't even understand what that is. Most people don't until they learn about them. So those are the things that they had said that they wanted. And then the C staff, how am I doing on time, Lisa? Sorry, I can't see my clock right now.
You're doing good. It's 1:22.
Okay, so maybe about 5 minutes or less.
Yeah, that's
okay,
good.
Great. That's perfect. Thank you. So this is sort of a cluster of what C staff said. So they felt that young adults themselves brought barriers to this issue of like engaging with NEET status. They saw them overcoming their own symptoms and really delaying. And I think sometimes even C staff felt that like they felt a little powerless about how to get through the delay. Like they didn't want them to delay either, but they weren't sure what to do. We also had, and I hope that this is resonating with a lot of you, but we had a lot of C staff say, when they finally are ready, they want to do it all at once, or they want me to do it all for them. And it's that kind of time and training that like success requires small tasks. So figure out what you want to do, try some things out, watch a webinar at the local community college about what it's like. Do these small tasks instead of just doing nothing for the whole 2-year program. We also found that there were a lot of barriers with helping families, or like sometimes, especially when there's in the cases of very low income families or families that struggle with their own resources, it can be very difficult for getting that family buy-in to say, hey, this is a 2-year or sometimes more than 2 years in some programs, program where we have a dedicated staff person to sitting with your young adult and helping them like start a career pathway and figure out what they want to do or how they might, be able to earn money. And this is the time to do it, not like when they're better or when we had some people say families just thought that like they should work and save money to go to college first. And that was sort of thinking like, really, like, is that going to happen in this 2-year program when this person's already 24, 25 years old? So really kind of educating families. And we think that actually bringing the family support specialist on the program in could be good. And so this thing about educating about urgency was important. And then there were program barriers. So the number one thing we heard is our vocational inventory or vocational assessment is way too long for these particular young people. It's asking about work skills and work history and all these like very minutia level things. And we want something that's shorter, more engaging, helps us open the conversation, and can kind of put that career development piece in. And so we are working on that actively. So this is just another conceptual model. This is more of like a research-based model that basically just says that there's a number of things that are leading to this delay in employment education work. But really, it's this low confidence in young adults because they don't have previous exposure to career planning. They dropped out of high school. They've never worked. This is also kind of like a overlap with some Gen Z cultural stuff also that I think is happening at the same time, and getting that mixed family messages about career planning. And then C staff are sort of working in the system that they're given and making and trying to get to fidelity on, but not really having the time or the focused energy to be able to help with this particular population. So what we are doing is we are building an enhancement to the C model. So we're not creating a different model. We're not trying to replace IPSY or C, but we are saying that, on every program, there might be 1 to 3 people per month, not even, maybe one person some months that are enrolled in your teams that really is at this spot and they need a little bit of a different kind of intervention. So what we want to do is have, a 6-month phase so that C staff or vocational specialists can work with these young people, meet with them, do the career development, help see if they're building their own confidence, find out what the real barriers are, and get them working on these small tasks. And so the immediate outcome is not job placement or what their goal is, but it's actually helping them start this process. Because as we know from those first slides that I showed from the Opus program, that when people have something that they've been working on, they can always go back to it. But if they're never working on anything to begin with, they're sort of lost when they're in the real world and they don't have access to employment specialists. So we see this currently as a 2-phase thing. We really want to improve, you can ignore the middle stuff here, but improve their engagement. So we think that the more this happens earlier on, the more we'll see more active appointments between C staff and these young people. We think that they will increase their career planning confidence, and that also leads to self-efficacy a little bit. So like kind of exposing yourself to it, trying it out, improving your confidence that you can do it gradually. And then eventually participating at the end of the program in at least something. So maybe they're enrolled in school, maybe they're working, but it could be that they are just still planning, and that's okay too, because it's better than the nothing that they're sometimes leaving with now. So, so that model I just showed you is something we have an active grant right now that is under review that we're hoping to be piloting. And we're currently going to be piloting it with 4 programs in Michigan with the Navigate program. And ideally, we will then be able to expand beyond the Michigan program when we find out what parts work, what parts don't work. It's a very exciting time. And so we'll talk a little bit more about that in a second. But knowing that that is a big project, what can we do as C staff now? So these are some ideas that came from our own C staff who participated in our study. So number one is just try to see beyond like the lack of goal or low motivation. And I think we've sort of used those terms for a long time. And what we're finding is when we ask young adults why they didn't get started or what was hard, they don't say, I wasn't motivated. They just said, I didn't have the confidence. And we heard that confidence word like 4 or 5 times from different young people from different states who were not in the same interview. So we thought that was fascinating. So really it's improving their confidence. And then understanding that young adults with NEET status, they may not yet understand like even how to choose a job interest, or how to go about this. So that's kind of where like those soft skills or those very small steps can come in. Realize that even during phases of deep struggles early on, sorry, I can't even see it. There we go. Early on in the program, we can be available to start offering career planning, even in the idea phase. So maybe someone's really struggling. They're maybe struggling to even talk and have conversations with program staff. sitting with them and thinking about like, what did you like to do in high school? What did you like to do around your house? Just like very basic early stuff. Families may need additional support and education to support their child to develop a career idea. And sometimes that's a new concept for a family. Sometimes it comes to ideas about psychosis, like, oh, psychosis is never going to work, kind of that old idea that we try to demystify on early psychosis programs. But, families may still come with that idea. And then also, helping them think through, well, what would that look like for this young person? And then really, this is different. This is not place then train. This is kind of pre-work to improve work and school literacy. That's that kind of understanding about just how getting a job works, and then really improving that self-confidence to move towards working or school. So these are just some things maybe as a team we could sit and think about, are we doing this? At what level could we do this more? And then I just had a couple of closing slides here. So we're actively building a website right now. We're collaborating with additional state psychosis programs for what will eventually be our larger trial, we hope. We're also building a new adult career advisory group. So some of the young adults who we had met were interested in continuing in this idea. They're really excited about advocacy for career development for young adults with psychosis. So we currently have a young adult career advisory group. It is meeting every other month, and it is really wonderful, and it's young adult driven. So if anybody is interested in that, I do have this flyer right here. You could take a picture of this if you want, and go ahead, and this QR code leads to a Google form to sign up that you're interested in. So it's $100 each time every other month. And it's about a 90-minute thing. And my email is the same here on this slide, although the hyperlink looks like it's broken as it is on the previous slide. So I will just end here and say thank you for having me. I also want to thank Kim User for inviting me to this. Kim is our active collaborator, my co-I on the study that I brought up with you all, the pilot study in Michigan, as well as all the individuals that are part of Michigan Navigate who've been partners for this whole process.
Thank you, Shannon. That was awesome. Before we kind of get started in some of the in-depth questions that we have coming up, a few people in the class were asking, could they get access to your PowerPoint presentation?
Yes, I will send. Some of the stuff is in a research grant, so I can't share it, but some of it I can edit it and send it back to you all.
Okay, that's great. So once you edit it, just send it back to Amanda and I, and Amanda will help us disperse it to everyone later. Okay, awesome. Very good. So we had some questions early on about the folks that you're referring to as our young adults. Could you specify that age group, and are some of these participants that you're speaking of, are they receiving SSI?
Yeah, great question. So when I'm talking about early psychosis programs, it's kind of assumed that it's depending on the program, you can admit people as young as 15. Typically, I think it's like 18 to 24, 18 to 35. There are programs now that are doing 15 to 45, I believe I recently heard, trying to really up the upper age limit, especially for people with later onset psychosis. But typically, the mean age of the individuals that are coming, who participated in the study, is about 21, 22 years old. So that kind of the middle of the group. Yeah.
Okay.
I want to add to that and mention that some states that have had such amazing implementation and startup of their early psychosis programs that they're actually serving now younger and younger individuals from high school. I think that this particular work is going to have even more of an impact for those of you working with younger people who, regardless of if they've had work experience, they haven't yet hit this planning track. And they may or may not be getting that if they're in high school or not in high school. So also really important.
Yeah, very good. We do have a question, and I'm I'll probably struggle with the pronunciation, but Steve asked how to address the lack of employment problem when a loved one has anosognosia, the lack of interest type disorder.
That's a great question. And I think that is one of those extra complications, right? That is added on to something. So, I guess I would, in that situation, I would encourage like thinking creatively around how to learn more. I mean, so full disclosure, not an expert on that particular disorder or symptom, but I don't know, like, is it expressing, or is it like someone can write about what they're interested in? So is there another way to try to learn more about kind of through the cognitive maybe barriers about what that person is interested in, even if they're not actively showing interest in things? But that's, again, my idea without any knowledge of the actual disorder. So full caveat to that.
Okay, very good. Thomas asked, or states first that you've been hitting some nails on the head throughout the presentation, but they were just wondering, you mentioned partnering with various states. Is this in reference to the advisory panel, or is that through some other initiative?
Well, as this is actively growing, I mean, like I said, we're trying to get funding to do this one pilot, but the idea is to further expand when we have this initial data. And so if you're interested in kind of volunteering your programs, I'd love to, send me an email. We could have a meeting and chat about it.
Oh, awesome. Great.
Yeah.
And if you didn't grab that email from the slide,
I can put it in the chat.
yeah, that'd be great. Put that in the chat, or Amanda could. And email Shannon, and she'll get that to you, or set up a chat with you. So another question that we have is in reference to this person's program and how they might introduce career development as an option for the young adults they serve. So how to introduce that career development.
I'm sorry, do you mean just how to introduce the idea of career development?
Yeah. Yes.
Yeah, I think it's just in your everyday, when you're asking people, typically it's, do you have a goal of, do you have like a working or a school goal? And if they say no, follow it up with, have you ever thought about what you might want to do? So kind of very basic interviewing style things. Just kind of the way you would ask somebody like in your family if you didn't know, like I have some nieces who are struggling to know what they want to do and they're 22 years old. They're not in early psychosis programs, but you have to do a lot of digging sometimes to really find out what they're thinking. So yeah, so the other thing I didn't talk about in the presentation is that we've developed a short assessment tool specific to this particular issue. So we have areas where we're bringing in some motivational interviewing around engaging and improving in confidence and motivation. So those of you who are familiar with MI as a modality, there's that importance confidence ruler where you scale how ready you are and how confident you are. We actually have integrated that into the assessment tool. So that's something I would also recommend is, asking people, what would be the most important thing that you could see yourself doing someday? And then working back to, well, is there anything we could start today that would make you feel like you took maybe one step? And then you could scale it down even more and say, next week, is there one thing you could do between like Monday and Friday? Maybe you could Google it. Maybe you could go walk past a place that you wondered about working at, or a type of job or something like that. So really, it's these very small steps, as we mentioned.
Yeah, love that. Love that. Another question we have is, how might we approach and engage families to improve support for young adults?
That's a little bit of a black box right now. So I think it's going to really depend on the family. The examples that were given during our focus groups with C specialists were kind of all over the map, like the biggest barriers I think were with families who had this very like our kids all worked and this is what we do and they don't go to college and then they have one kid who got psychosis and needs maybe a little bit of a different intervention. And so it's just kind of that family psychoeducation about psychosis and going back to work and school, and then really just kind of learning with them what they can do to support. So really framing it, I think, around support. So like, this may not be what you thought for your child, but how can you support them now? What kinds of things can you do to, be there for them? And one of the things that we want people to ask families is, to really kind of have their back. So if the person says, oh, I'm working on these steps that we just talked about, like I'm going to do one step this week, another step the next week, being able to check in with somebody that in a social support way that says, hey, I did this week. And that person can just sort of like, oh, how did that go for you? Just having like somebody else in your life besides your counselor or your C specialist that knows what you're working on and that can really support you, just like we all need support when we're doing something new with our health or a new career change. It's helpful to have some friends know what you're going through. So we're hoping to have work with families to help them understand just how important it is to be supportive and knowing that not all of them are. We also know, thank you, Gary. I just briefly saw your comment come up. Yes, supporting families also. So most programs have, the active family support person. And we want actually to maybe pair that person up with the C specialist for these particular families because, why not have two people working on this versus just the one person?
Exactly. That peer support, that coming together and hearing the stories and inspiring hope and breaking down those walls of the stigma. Is so
Those of you who
important.
also run sorry, Lisa, I didn't mean to interrupt.
No, you're fine. Go ahead.
Yeah, we also really believe in multifamily groups. So those of you who do multifamily psychoeducation on your programs, Gary's comment about kind of meeting other families who are going through something similar, that can be really powerful for those families who are struggling.
Yeah, absolutely. We have another question. What do you believe would be the best approach with an individual who has identified a goal to work but do not interview well?
Great question. I have another past work that I did that actually used a virtual reality interviewing practice tool for this. And we saw really great results, believe it or not. It was not something I signed on for, but it's a way for people to practice and get real life feedback, but not from their clinicians, so that they can actually hear in some cases what they really need to work on in a way that's not interfering with the engagement and therapeutic relationship. I would say that's a tough one. I would want to know more about that situation of that person not interviewing well. I'm not sure what that means, not interviewing well. But yes, unfortunately, as we all know, when people do go out and do job interviews and it doesn't go well, confidence goes down. And so finding just a way to practice that. I mean, we don't necessarily have mock interviewing in the intervention, but that was something that employment case managers did for years, was just do mock interviewing with people. So that is something that some individuals would benefit from.
Very good.
Sometimes outsourcing that stuff to like your local DVR or like WorkSource, depending on your state, that can be something. I don't know what the funding landscape looks like for those programs right now, but that's another place where people can kind of go attend interview practice sessions that are not related to the early psychosis program, but they can then kind of learn, build on things.
Yeah. Okay. Very good. So we're getting close to our ticking down to our final hour here, but we have another question that's come in. asking for some tips you might have with working with young folks who have either didn't finish school, dropped out of school, they kind of feel off track. But they've done very well in functioning before the first episode of psychosis. Some tips you might have for working with those young clients.
So what we found in our earlier research, and this is supported by additional research as well, is that the biggest predictor of not being employed is never working. So anything that they did pre-psychosis, whether they were in school or they worked, is usually a sign of success for people or a sign that they can be successful. So, I think that there are people here who have a lot more experience working miracles with individuals to really help inspire them to get back on the tracks they had left. But I think that really it is restoring that confidence and finding ways to just have conversations about, what did you like about what you did before? What would it take to get back there? If that's what if you're asking how to get back to what they did and they still want to get back to that thing, asking them really, what was it that you liked? That's learning about their motivation, right? And then what would it take to get there is what are the barriers in the way between getting back where you are now and getting there. And sometimes it's physical stuff like transportation and, I'm homeless now or whatever. And other times it's that confidence and kind of going through the stigma of like, oh, now I have psychosis. So could I see myself as someone who does that again? In that case, it's talking about like adapting to the environment and accommodations. So figuring out what do you do when you might hear voices in that particular job, and the person kind of thinks of a scenario and what they could do, and then they figure out, oh, okay. And we've heard great examples of young adults who figure that out themselves without the help of any vocational support. And they were like, that was when it worked for me. When I went back to work, figure out a way to like ignore my symptoms. And then I just kept building on it and doing it.
Very good. We have another question here. It says, I noticed that it's difficult to build relationships with employees because our participants often no-show or do other things that these managers would not accept from another employee. How do you build trust with employers when you are introducing them to young people with these struggles?
So is it NA? This area is not one that we're working on right now. It is one that, the IPS model does a lot of work on. So I'm probably not your hot expert on this. I have no take. Because I know that's an issue and I know that it has to do with employer stuff. And I'm sure there are other individuals here that have dealt with this, but this particular research is really all about the front end of helping people even get toward that direction. I'm sure there are people here working in the field who have examples of having to talk to employers and either working it out or in some things that helped to work that out, or having to kind of abandon that employer. And one of the things that's interesting, I keep coming back to this like Gen Z thing, but we're seeing this kind of stuff from everyone right now in a kind of a post-COVID world. There's a lot of kind of everyday job skills that haven't been picked up or aren't seen as important. And I think that that's something that employers are struggling with in general more, and it sort of eases in some ways some of the issues with psychosis. But yeah, I mean, I think what you would do in that situation is bringing them back and asking them, what do you think went wrong? What do you think you could do differently next time? And I think that's really all you can do with young people.
Yeah, yeah. And I think too, getting people involved in those support groups and peer support and things like that can also help young, old, to kind of hear from people who have experienced certain symptoms, disorders, who are now successful in employment, and hearing their barriers and how they overcame those barriers could be helpful. Okay,
Mark, did I get to your second question there? I think I maybe did at the end of my response about specifically asking more about people who are feeling pessimistic because they have psychosis. We did hear a lot about that as young adults really talked about. Some people use the word stigma. Some people just use the word, I didn't feel like I was the same person after I got diagnosed. So we also know that there's like a negative impact to the labeling that happens where there's sort of like a me pre-post psychosis idea. But we do find that the people who are able to get back on a work or a school track, as they take those small steps, their confidence goes up, their stigma goes down. Also, sometimes meeting other young adults, maybe in the program, who are ahead of them, who can model, like, this is what worked for me. So we actually had that peer modeling piece in this enhancement, the intervention, but we just don't know how well it will work as like a packaged thing because it'll be different everywhere. But we love the idea of having your peers in the programs who've been successful, like offering to speak or offering to maybe do some low effort mentoring with young people who are just starting out.
We did get a message from a participant today that was just to us, so I won't mention the exact of it. You can, Shannon, you'll be able to see that in the chat. But I just wanted to make mention that that someone shared about the success in this type of recovery in work and vocation, and giving their loved one a sense of creativity and connection to their community and a purpose. And they felt like it was critical to their young person's long-term recovery. So just wanted to mention that there are folks out there who are expressing success, and wanted to let everybody know that. But you can read that privately, Shannon, later. But thank you for sharing that. That was good to see. Good to see. One last thing, one way to build trust with employers is to engage them as being an assistant to them in working with the individual to molding them to be the best employee, is a statement from Byram Martin. So yeah, very good.
Yeah, that and job coaching somebody mentioned, which is part of the C model and the IPSY model for working with the employers.
Yeah. All right. Well, we are coming to the close here. Shannon will work on an edited version of the presentation, and we will get that out to folks that joined us today. But we want to thank Shannon for answering our questions today, and I want to thank all of you for attending. At the end of this, when you log off of the webinar, you'll be asked to fill out a very, very short survey. So we would greatly appreciate if you take a few moments to fill that out. It's very important to us as we continue this work. So thank you all for attending, and we look forward to seeing you guys in the next Ask Me Anything webinars.
Lisa,
Shannon,
could I add one more thing before?
Yes, please.
I forgot. I was scrolling up through the chat, and I realized somebody asked me if people were on SSI, the ones that we're talking about. And I meant to say that, and then I went beyond it. Sometimes yes, and sometimes no. So the people that we've interviewed in Oregon oftentimes are not on SSI in these early ages. Their parents are sort of encouraged not to automatically apply for it, because it can like start to cement these not actively working on career stuff when somebody does receive SSI. So we've sort of seen that as like sometimes it's okay to be on it, sometimes it's good to wait. And so we don't have like any hard and fast rules on that, but I think it varies a lot depending on if people are already receiving it or not. Sometimes youth are receiving it before they're age 18, and so then it's sort of already there. But I'm sorry, I missed specifically.
And I got sidetracked too on what you went to. So thank you for catching that. All right. Well, thank you, Shannon. Thanks, everybody. Thanks, Amanda. And we'll see everybody next time.